Let's switch gears now and talk about vaccine boosters and third doses. So much has been in the news lately about third doses and booster doses, and I wanted to spend a moment clarifying the difference between the two because this is confusing. And then I want to get into more detail about the news from last week's announcement from FDA and CDC on boosters. So first, let's talk about third doses, which are also being referred to as additional doses. They were authorized August 13th by the FDA for emergency use for people who have moderate or severe compromised immune systems, meaning those are people who may not have been able to develop the same immune response as other individuals. And so this might include recipients of organ or stem cell transplants, those in treatment for HIV or cancer, those taking immunosuppressive therapies like a chemotherapy or high-dose steroids. We also, based on our Delaware data, as well as national and international data, are asking providers to use their clinical judgment to determine whether age and long-term care residency should make individuals eligible. And that would be especially those who are over age 85, whose immune response may not have held as long as others. So for third doses or additional doses, if you have received Pfizer or Moderna at least 28 days previously, individuals can get a third dose. And I will say for third doses as well as boosters, they're not authorized for Johnson & Johnson recipients yet, although that is being studied. So that's third doses, again, for people who are immunocompromised. Last week, the FDA voted to authorize booster doses of the Pfizer vaccine, so only the Pfizer vaccine, and only to persons who had completed their initial series of Pfizer vaccine at least 6 months ago. So data from a clinical trial show that the booster dose of Pfizer vaccine produced a 10-fold increased immune response against infection and severe COVID and restored high levels of protection, especially among older adults. Among adults 65 and older, the data show that vaccines remain effective in preventing hospitalization and severe disease, but the recent evidence suggests that they are less effective in preventing infection due to waning over the time. And the Delta variant has made this even more complicated. And so these are the reasons why the boosters are especially important for our seniors. Boosters are not yet authorized for Moderna, unlike with third doses, and again, not authorized for individuals who've had Johnson & Johnson.